See, I'm Dr. Dinesh. I'm a dermatologist and dermatosurgeons and also hair transplant surgeons. So, from many years, I have been doing the natural hair transplant. So, which is in case of those who have lost hair, especially both in men and women, due to their genetic uh, inheritance from their parents. That's called as androgenic alopecia. In such cases, we used to treat them with the natural hair transplantation. That is, taking the hairs from the donor area and putting their own hair on the recipient area, that is the area where they have lost. So there are many cases. There are conditions like where some people they don't have sufficient donor area to cover the baldness. So what we have to do in such cases? Because the donor supply is very important in case of a successful hair transplant surgery. So to find an alternative to this, we have been mm, tracing the different methods of giving a successful treatment for those patients who have less donor area. Among these, you see, already we have introduced scalp micropigmentations and some PRPs and even updated PRPs like GFCs and sonicated PRPs. All these are all the results are pretty late and unpredictable. So to find the better one, we found the artificial hair fibers. That's called biofibers from Italy, which is made from the polyamide materials and which has been tested and has been successfully implanted in many patients. So we have been doing this procedure since many months, years. So this is one of the best alternative what we have found presently if those who don't have the good sufficient donor area. So these artificial fibers, which called as the biofibers, or in the one which is from the Italy and other one is from Japan, it's called Nido fibers. So these are the two most popular and well tested and authenticated reliable fibers throughout the world. So such fibers we have introduced in our area of treatment for baldness. And this, the advantage of this hair fibers is that you will see the immediate results. It's not like that a natural hair transplantation where we have to wait for 6 months to 9 months or 12 months to get the comfortable results or good results or short results. So in this fiber, this biofiber artificial hair implantations, you will see the immediate results. And it is also we don't need any donor area suppliers. We are not concerned about the donor area supplies. So how much hair fibers we want, we get it. Maybe up to 4,000, 5,000, 6,000. So that quantity is not at all a problem here. So initially, while taking the patient for biofiber, we do test patch of about 100 fibers. So once we do the test patch, we wait for 15 days to 1 month. Then if there is no any inflammatory effect, there is no any side effects, if there is no rejections, then we take for the full implantation of the artificial hair fibers. And we have an exclusion criteria, like suppose the patient has got a diabetes or autoimmune disease or some the terminal diseases, we exclude such patients, and those who are healthy patients only we select them, and we go for this the treatment. And with diabetes also, once it is controlled, we can also go for this one. Only thing is that there have to be extra care with the infection part. So what are the different types of hair fibers length we are getting? One is that, see, biofibers we have 15 centimeter and 25 centimeter and 45 centimeter, and the needle will get only 15 centimeters. And one more very important thing is that whatever the length we put, neither it will increase in size or decrease in size. Suppose if unfortunately if the barbers or somebody cuts the hair, that is the length will decrease. So neither length will grow nor decrease on its own. If somebody cuts, the length will decrease. So that is one has to be careful while suppose trimming the hairs. And these fibers can be implanted in patients who are completely bald, who don't have any supply from the donor area. Also in those patients who have undergone the natural hair transplantations and they have densities, they are not happy with the density, we can add this to the fibers, existing hairs. So we have to be careful that between the two fibers, we have to keep the distance of 2 millimeters. we cannot bring closer to that. And if you calculate, as you know, that we are calculating per square centimeter, the natural hair transplant is about 40 to 45 centimeters. And same we can apply, the same principle also we can apply. 20 to 40 fibers per square centimeters we can put it. So, and one more thing, very important thing is that you should not put this on the frontal muscles or temporalis muscles. And second thing is the depth. The depth is very, very important in this. This is not like a natural hair transplantation where you have seen many non-technicians, non-doctors are doing the head natural. This artificial hair transplantation, one should have a skill because we have to go to the subgaleal area and we have to have a knot there. Otherwise, the fibers will come out. So this is very, very important. So here the doctor's skill is very, very important, and only the doctors who are qualified like plastic surgeons and dermatologists alone can do this technique. If anybody claiming that they are doing it, one is that it's very expensive. Second thing is that it causes a side effect if it is done by the non-skilled or a non-qualified person, and the results are pretty bad, and there will have a lot of side effects. So you approach the best, those who have experience in putting these artificial hair fibers, like a dermatologist and plastic surgeon. For them only they will give the best and good results. So artificial fibers, though sounds very easy, but one has to be careful with the implantation technique and the follow-up methods post-implant, like what all to be followed. Suppose if there is in case of any excess sebum secretions, any folliculitis, what are the instructions it has to be followed? It should be given by the experienced, the only medical doctors who are qualified in doing these procedures. Any other person who claims that they're putting this artificial, don't say. Second thing is that it causes a side effect if it is done by the non-skilled or a non-qualified person, and the results are pretty bad, and there will have a lot of side effects. So you approach the best, those who have experience in putting these artificial hair fibers, like a dermatologist and plastic surgeon. For them only they will give the best and good results. So artificial fibers, though sounds very easy, but one has to be careful with the implantation technique and the follow-up methods post-implant, like what all to be followed. Suppose if there is in case of any excess sebum secretions, any folliculitis, what are the instructions it has to be followed? It should be given by the experienced, the only medical doctors who are qualified in doing these procedures. Any other person who claims that they're putting this artificial, don't trust them, because this is not as simple as the natural hair transplantation. One has to have the experience in this. One has to give the interest in this. So the patients who are opting for this artificial hair fibers, they see the quality of the doctor whom they are approaching and their credibility. So this one of the best alternative to those who have lack of donor area, those who want the more density in the hair, density of the hair on the scalp. So such cases, both men and women, you can do it. There is no such contraindication in men or women. Women also can undergo. And this is one of the new added thing to improve the service to those patients who are requiring for their improve their hair density on the scalp. And this definitely is going to help. This will be maybe the future in case this. Earlier there was some side effects or more few years back. Now that has been fine-tuned. Now the side effect is very less, and it is through the doctor's follow easily those side effects can be controlled, and patient definitely will have this successful procedure, and success rate you can say 90 to 95%. And the other thing is that the fibers, some 10 to 15% pilferages will be there. See, like there will be loss of 10 to 15% fibers after the post-implant once in a year. So this has to be refilled again, and that can be done. So those who don't have the sufficient hairs to transplantation, this is the best alternative options, and we are doing it, and we are definitely going to assure the patient that the best results, provided they have a serious in their procedures, because the follow-up is very, very important. Without that, the doctor also can't help. So this is the latest advantage.